hepatitis is any inflammation of the liver caused by a specific virus. There are a number of viruses which can cause viral hepatitis, from hepatitis A to hepatitis E. Some of these are transmitted in different ways. Some have vaccines, such as hepatitis A and hepatitis B. But the concerns we have are around the viral hepatitis which cause chronic viral liver disease or chronic liver disease, namely hepatitis B and C, and in some cases hepatitis D, which can complicate hepatitis B. Viral hepatitis is essentially diagnosed by abnormalities in the liver enzymes, where we see abnormalities in the transaminases, and these are confirmed by viral serology, which will be able to identify the virus which is causing the viral hepatitis. There are a number of other investigations we would also undertake to investigate this further outside of laboratory tests, such as ultrasound scans, fiber scans, and in some cases, liver biopsy. The treatment for viral hepatitis will depend on the virus causing the hepatitis in the first instance. For example, hepatitis A and hepatitis E tend to be acute and self-limiting infections, meaning they get better themselves. The difficulty with viral hepatitis are the viruses which cause more chronic disease and lead to chronic liver disease. These are specifically hepatitis B, hepatitis C, and in some cases, hepatitis D or Delta virus, which is a super or co-infection with hepatitis B. For hepatitis C, we have new, very effective antiviral drugs which can eradicate the virus in up to 95% of patients in relatively short periods of time, sometimes with treatment for only 8 or 12 weeks. Hepatitis B is more challenging in that we're not able to really deliver a cure when we treat it. And what we're actually trying to do in this case is virally suppress the patients or reduce the virus to very low levels where we don't think it causes harm. This means that in hepatitis B, quite often patients will be on medications for a very long period or even lifelong in some cases. However, there are significant changes afoot with new drugs in development which should improve our ability or chances of achieving a cure in hepatitis B. Also, we are still using pegylated interferon in a proportion of patients, and this works by boosting the host's immune response against the virus, essentially helping the patient to control the virus themselves. But we'll see a lot of developments over the coming years in the treatment of hepatitis B, as this is really an area of very rapid development. One of the latest developments in the diagnosis and management of viral hepatitis is the use of FibroScan. FibroScan is essentially a non-invasive modality for us to assess the degree of liver damage or liver disease in patients presenting with viral hepatitis. So previously, where we would often need to perform a liver biopsy to assess the amount of disease, these days we're able to use this simple, non-invasive technique, which takes about 10 minutes, to assess the amount of damage there is in the liver. This means that patients at the same consultation are informed of whether they have significant disease or whether we're able to exclude significant disease. So this is a major development in the field. The ongoing treatment and management of viral hepatitis is relatively straightforward. Where patients require treatment, and treatment is successful in the case of hepatitis C, it's common to be able to discharge these patients from the clinic, provided there's no significant established liver disease. In this instance, we would use FibroScan, or in some cases liver biopsy, to confirm that there's no significant fibrosis or liver scarring. If this is the case, and the virus has been eradicated, patients can be discharged from specialist care. However, in hepatitis B, because we use drugs to virally suppress the patients to gain control of the virus without eradicating it, the treatment is more long-term and the supervision and monitoring are also long-term. In this case, we'd often use FibroScan to assess the patients longitudinally or over intervals of their follow-up. And where patients are on treatment, the FibroScan can often be used to see if there's reversal of that liver scarring or liver fibrosis. And clearly that is one of the major goals of current treatment strategies.